So hopefully you've taken a second to kind of understand what that specific bias is, and we'll give the answer here right now, and that is actually the Simpson's paradox, which he had just talked about. So the table here shown to the left actually shows a study regarding small and large kidney stones and two different treatments, A and B, and their success rates among these small and large kidney stones. Something that actually tells us that this is the Simpson's paradox is that we can see that treatment A actually, when split into the small and large kidney stone groups, actually has a higher success rate over treatment B. However, when we look at the total population, we actually see a complete reversal of the results of this study, and we actually see a higher success rate among treatment B over treatment A. And this, of course, tells us that we actually had a reversal or an emergence of a different correlation when we split our total population up into these different groups of small stones and large kidney stones. So another question that we want to propose to you guys are, what are some of the consequences of biases and misrepresentation of data today? I want you guys to think about the answer to this question as we go over these next few slides. Let's actually dive into the racial bias in the healthcare system as well as the US Census. So starting off with the 2020 US Census and some general census facts. The census is taken every 10 years, and it helps us account for and determine different funding levels for a broad range of state programs, as well as public health initiatives. However, there is severe undercounting when it comes to this US Census, specifically with minorities, and around 3.68% and 3.57% of African American and Latinx populations, respectively, have been severely undercounted. This accounts for around 4 million people. Of course, this has an impact on the public health initiatives that those individuals would have had, specifically Medicaid, community health, housing and food assistance, as well as policymaking. Moving on to racial bias within the healthcare system, and specifically within the healthcare risk prediction algorithm, which is a major tool that's actually used on more than 200 million people in the US, particularly in hospitals and insurance agencies, to help determine the cost that these institutions are going to charge for a given individual for a medical procedure. They were actually found to demonstrate racial bias because they relied on a faulty metric to determine these algorithmic risk scores. And specifically, that metric was the prior cost of those individuals' Medicare needs or medical needs in prior years. So in conducting this study, they actually used around 50,000 patients, 6,000 of which were Black individuals and 43,000 of which were white individuals. And they actually found that patients who were classified as very high-risk Black individuals turned out to have 26.3% more chronic illnesses than the white individuals did, even though that they exhibited the same algorithmic risk score, showing this disparity between minority individuals. Another couple of reasons why a cost is not a very reliable metric in determining these algorithmic risk scores is that race and income are correlated. People of color are more likely to have lower incomes, and poorer patients, even when insured, tend to use medical services less frequently or have to reduce access to them because of time and location constraints. Studies show that Black individuals who often experience implicit racial bias when they do access these medical services result in lower quality care and less trust in doctors, whom they feel they're again exhibited racial biases from. Obviously, the results in these decreased likeliness of requesting extra care end up paying for it in the end with their algorithmic risk score. So now that you guys have a little bit more of a background within biostatistics, specifically the case study that we went over with John Snow's pump in 1850 London, as well as some of the common biases and misrepresentations, as well as racial bias that we see within our healthcare system in US Census in our nation. Let us know if you have any questions. This is definitely going to be helpful if you ever find yourself in a position of conducting your own research study or analyzing one in the future. But I wish you the best of luck in the remainder of the summer program. It's been a blast teaching you all. All right. Thank you guys.